Greetings. My name is Dr. Dawn Smith-Williams, and my poster topic is Pediatric Sleep Disordered Breathing and ADHD, incorporating the dental team in the screening process. Sleep disordered breathing is a general term for difficulties that affect sleep, and it includes adult as well as pediatric populations, with our focus being pediatric populations. Sleep disordered breathing is classified as primary snoring, upper airway resistance syndrome, obstructive hypoventilation, and obstructive sleep apnea. And they include all of the previous things I've mentioned, as well as difficulty with breathing, mouth breathing, sleep disturbance, and hypopneas during sleep. Most of us are familiar with ADHD, which is attention deficit hyperactivity disorder, which is a neurodevelopmental disorder. Untreated, both sleep-disordered breathing and ADHD can cause medical, psychological, and academic challenges, including depression, anxiety, cardiovascular issues, obesity, and behavioral and learning disabilities. Signs and symptoms of obstructive sleep apnea, part of sleep-disordered breathing, are many, and I've mentioned a few, but it also includes others, including morning headaches, difficulty staying asleep, restless sleep, bedwetting, and the child just plain being restless and awakening frequently throughout the night. Noted with ADHD are behavioral problems, aggressive behavior, attention deficits, and overall poor school performance. Screening. Screening begins with the medical dental social histories and probing questions that are directed at the parent or guardian, along with the oral exam of the child. There is a pediatric sleep questionnaire sample on this poster that's utilized frequently, as well as any history of a sleep study or having the tonsils and adenoids removed, which is called an adenotonsillectomy. Mallampty scores are also a screening method that are utilized, with scores of 3 or 4 as indicators of a narrow airway and increased chances of having obstructive sleep apnea. What does the literature say? Research by Urbana et al. In 2021 noted that the relationship between ADHD and sleep disordered breathing is exacerbated by the symptoms of each condition. The literature also notes that fragmented sleep and sleep deprivation worsens ADHD behaviors. From a surgical perspective, literature from Amati et al. In 2016, as well as Amiri et al. In 2015, note that the adenotonsillectomy noted improvement in ADHD symptoms. As we incorporate the dental team, the dentist, hygienist, and assistant are well poised to screen, utilizing the medical dental social history, pediatric sleep questionnaire mentioned previously. However, the doctor, of course, would take the lead in treatment planning and treatment recommendations, which may include appliance therapy, myofunctional therapy as early intervention, and orthodontia. The front desk and billing staff would be integral in familiarity with ICD, the International Classification of Diseases, as well as CDT codes for insurance filing, insurance billing, and reimbursement. Collaborations with other specialists make a multidisciplinary treatment team to provide comprehensive care to the pediatric patient and provide levels of support for the parents and guardians as they advocate for their child. Lastly, as licensed practitioners, staying abreast of evidence-based research will drive future recommendations for your practice. This concludes my presentation. If you have further questions, please feel free to email me at dawn.smith@howard.edu. Thank you for listening.